Hi, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. You're watching this video because you have some low back pain and you have some symptoms going into your legs. So what this video is designed to do is to help you kind of self-diagnose with my advice and what we're going to do now in this video so that you can figure out if you have any palliative positioning. Palliative positioning is positioning of yourself that gives you relief from your symptoms. So there's 4 different positions we're going to try. If any of those make your low back pain and your leg or hip, anything going into your lower extremity feel better, then we know that that's your palliative positioning, and you're going to go into, just below this video in the description of the video, there's going to be a playlist for each one, and you can just follow that. I'm going to organize the videos in the least intense to the most intense so you can work in that order, and always make sure whenever you're doing any of these exercises that you're not causing any more pain. If it does hurt, then you may have the wrong positioning, or you may not have palliative positioning at all. So always make sure that there's no pain when you do it. If it does hurt, back off in the intensity. If it still hurts, then that's when we're definitely going to walk away from this. So the first palliative positioning is flexion. You're going to stand up straight and just bend forward at the waist slowly. You're going to bend forward, and if you feel as though this makes your back feel better, you can bend all the way, then you're going to decide that your palliative positioning is flexion. A lot of people, when I show them this in the office, they'll start bending from their upper back like this, and they'll just bend like this. But if you notice, this is not even moving, and they continue to bend, and what ends up happening is they actually go into extension as they bend, which is going to be the next one. So make sure when you're checking for flexion of palliative positioning, you're bending at the waist, you're bending at the low back, you're trying to like push your low back that way while you bend forward. Like this would be flexion, palliative positioning. If that makes your low back feel better, then you're going to go to that little item description below, click on flexion playlist. The extension one, on the other hand, is leaning backward. This is the opposite direction. Again, you want to make sure you're moving more in the low back, arching that low back and going backward. If this makes your low back feel better, then you are an extension palliative position patient. So you're going to click on the extension playlist and follow those videos. The other ones, they're pretty much the same thing, they're just different directions. So I'm going to have one playlist that's lateral flexion. You're clearly going to choose the side that makes you feel better. You're going to bend, try to kind of hold your hands at your side, and one arm is going to go down as you bend at the waist. Remember, we're trying to make sure we're bending more at the low back than the upper back. We're trying to really make sure, kick your one hip out to the side that's going the other direction of the bend. The same thing on this side, we're going to check that too. You may even have a combination of flexion or extension in combination with lateral flexion, okay? So check that. That might be the case. If you do, you can check out the lateral flexion playlist with either the flexion or extension one, and you can find out, okay, those are the ones I'm going to follow, and you can kind of combine some of the exercises. There might be a way to bend forward while also bending to the side, where you're kind of pushing your butt out as you bend. So I'm bending to the left and bending forward, and then you're finding that that feels better. You're going to do that. This is very important that you follow these very strictly to what I just explained. And the cool thing is, you might be able to cure herniated disc, or at least help resolve symptoms. If you do end up needing an adjustment, you can always go to a chiropractor. You can come in here if you're local or if you're willing to travel. Or you can go and give this information to an orthopedic surgeon, and that's very helpful for them, because what's happening here is when you're bending in a certain position, what's happening is the disc is actually getting slid in a position where it's no longer aggravating a nerve. So a herniated disc is basically just like when you pop a yolk when you're frying an egg. If that disc is poking out on the side, on the right, let's say, and you bend to the right, it's squishing the disc even more, and it's pushing the disc out further, putting more pressure on the nerve. But when you bend the other way, the disc is out to the right, and when you bend to the left, now it's taking this pressure off of the disc, so the disc is kind of hanging out and feeling happy and not putting pressure on the nerve anymore. So all you're doing is you're trying to figure out where the herniated disc is in relation to the nerve that's being irritated. You're getting the disc to slide away from that nerve with the palliative positioning. With enough practice and enough of diligence doing the exercises, you can really take care of a herniated disc on your own, which is pretty awesome news. I've helped my brother-in-law with this, never even saw him or touched him, just sent him videos of different flexion exercises, and he was able to fix his herniated disc on his own in a couple weeks. So thanks so much for watching this video. Good luck. If you have any questions, please make sure that you post them below. I'd be happy to answer them. This is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic.